I'll just say a few things before Dr. Ukot has the microphone. So, as usual, our housekeeping, you can there'll be some polls. It's going to be very engaging. There'll be some polls where you can engage and submit some questions, which will guide the conversation this evening. And then we can have you drop any questions that you want to have, either using the Q&A session or the question and the Q&A session or the chat box. And at some point in the webinar, I'll be able to read through and then we can have Dr. Ukot attend to these questions. So permit me to welcome and present to us first time ever on the EJ Clinics Academy platform, Dr. Ian Ukot. Good afternoon, sir.
Thank you very much, Obinaya.
Yes, sir.
I thank you and thank EHA for inviting me to do this presentation. It's not going to be a lecture. It sounds like a medical stuff, but it's going to be a very interactive session for us. And I just hope that the participants are ready to participate. I don't want to call them attendees. Please, let's not be attendees. Let's be participants. So I have been in the business of teaching for many, many years, since 1985. And I wrote my first book on medicine in 1996. And since then, I've been writing. It's been a pleasure to walk outside the four walls of the university. And by the grace of God, my first book, which came out in 1996, was followed by another one in 2018. You can see that was a very long time, very long interval, 22 years interval, but good enough. And that book and another one, the book I'm referring to, the one of 2018, is called A Companion to Medical Students and Doctors. The next one is a book on multiple choice questions. These two books were recommended or suggested reading material by the Medical and Dental Council of Nigeria as the only two books that foreign-trained medical graduates were asked to read to help them with their assessment to become licensed to practice medicine in Nigeria, and also to help them in their actual practice, not just the assessment, that is examination that they had to write. So that is the only aspect of me that I will want to mention, apart from the fact that in my many years of practice, this year, 44 years, most of my patients have been women. And women are very interesting people. And I also love working with children. So women and children, that doesn't mean that I don't attend to men. I do. So in short, I attend to the entire family. But all of us know that it is the women that bring the men to the hospital. I don't know why that is so. Somebody may carry out research on that. So the topic for today is lifelong care for women. And the emphasis is to build health, build resilience, and build balance. We are going to look at each of the components of this topic as we go along. And I intend to finish in 45 minutes so that we stay within the time frame that we had originally. So let us go. As we go on, you will find that the last qualification that you see there is very useful. It's been very useful to me because it helps me make a connection between the work that people do and their health, and the connection between their health and their work. So we'll start now. Next slide. We'll continue rather. Next slide.
Okay, Doctor, we take the poll.
Okay, yeah, yes, that will be the next poll. The poll will be the next thing before the first slide.
Okay, so you can attempt the polls now. Can they confirm that you can see the polls? I'm not seeing responses.
Yeah, I can see the response says no. 2 no's.
Okay, let me see.
3 no's.
Okay.
4 no's. Yes, none.
Okay. Okay, so I'll give another 15 seconds. Okay, I'm ending the poll now. So that I'm sharing the results. Doctor, can you see the result?
I've not seen the results. I'm still seeing the poll.
Yes, it's showing, but as a result.
Sorry, Elijah?
Yes, what is showing right now is the result. Like you see the number of questions answered, then the percentages.
Okay,
Yes.
so I'm correct.
It looks very similar to the poll itself.
Mm. So, Doctor, can you see the responses? About 38% chose A, 50% chose B.
Sorry, say it again. I can't see the results at all.
Okay, so 38% chose A, which is care after attaining the stage of womanhood, and 50% say care from birth to death. Then 0% chose care from development of small swelling around the nipples. Then 13% say care from the first menstruation.
Yes, that is the correct answer, number B. Care from birth to death.
Okay.
Can you now have the first slide? Care, what we are discussing is lifelong. We're discussing care, then women, building. Yes, can you remove this poll, please?
Okay, it's still
The poll
showing.
is still on my screen.
Okay.
Anyway, what you are building,
I guess we're good now, Doctor.
correct. We are building health, resilience, and balance. So we are going to pick each of these along the line, and then we are going to integrate. Can you show the next slide, please? Lifelong is actually, can you go back? Lifelong is from, can you go back and show the slide with the fingers, with the hands? Yes. If you look at those hands critically, you find that these are the hands of a tiny woman. I use the word tiny because the hands are small. It is the same person with that small hand that will progress over the years to the hand of the teenager that you see, which is the second one, and then the hand of an adult, which you see, which is the third one, that is looking at it from the left side of your screen, and eventually the hand of an elderly person. So the care that we are talking about is throughout that period, the entire period of the person's life, and that is why the B is the answer to that question. What does lifelong mean? Lifelong is not the same thing as eternity. It is as long as you have life here on this planet. So, what we are going to discuss is limited to the day that a baby is born up to the time the person dies. So, we do not want to show something about the hand of a dead person because that may disturb the sensibilities of some people. But those of us who are doctors, we are used to all that. Now, we know that life starts before the appearance of this first hand that you see, the hand on the left, that's tiny hand. It starts right inside the womb. And to shorten the presentation, I will not want to go into what happens to the woman in the womb, the woman inside another woman's womb, because that baby is actually actually a woman in evolution, a woman who is developing, a baby in the womb. So many things happen there, but we are going to concentrate on what happens after that baby comes out. If there are questions regarding what happens inside, I will answer. That will show that one or two or three people are interested in what happens before. So we'll look at the next slide. Next slide, please. Next slide, please. Now, we are talking about life care. So, hello. Please, let's go stage by stage. So, hello. If I will not want to go back and forth, I can discuss this if you want me to discuss this. Prevention of damage and loss, that is care. And then protection and enhancement of well-being. For you to care for something, there's at least one preposition. It is assumed that the person who is trying to care for something knows what they are caring for. What is it that you know about what you are caring for? Number one will be that what you are caring for is worth caring for. So if you look at this picture, the one on the left side, I will pick some of the things that are shown there. You see a shield. That shield is protecting the person that you see there from certain things. If you see something on the right side, this white circle with spikes, that refers to a virus. As a matter of fact, that looks like coronavirus. But we are not referring to coronavirus now. We're talking about viruses or anything that will cause illness. So you are caring yourself to protect yourself from something from outside, something that could happen to you from outside. If you look at the left side of the image, you will see a bottle. That is a bottle of medications. I don't want to use the word drugs. A bottle of medications. The medication can be for prevention and it can be for treatment. But whether it is, whatever it is, you're trying to prevent damage to the body and prevent loss to the body, to the function of the body. The next one that you see is protection. Protection and enhancement of well-being. So you need to protect and enhance your well-being. This person here is showing a form of exercise, but it is an indoor exercise like meditation and so on. So this protection can be from everywhere, any form, any means that you can think of to protect yourself. So that is care. Now let's go back to the practical things that we see in our homes. What do you do when you have children in your home and then you have a hot electric iron? For example, if you were ironing and then you received a phone call, what would you do? Will you just dash off and leave the iron on to go and pick the call in your room or in the sitting room or go downstairs? I don't think you do that. If the word care stays in your mind, because you were thinking that you want to prevent damage or loss. You don't want to go to hospital from the iron burning a little child that may want to go and touch the iron. Therefore, you keep the iron away and then remove it from the socket or switch it off from the wall, at least switch it off from the wall to cut off the power and gradually reduce the intensity of the heat. That way you'll be preventing damage and loss, and you'll be protecting you're protecting the well-being of the little one in your house. I'm just using that as an example. Still on care, there are many homes that are clogged up with property. It may not be your home, but I'm sure you will identify with what I'm trying to say now. There are many homes that you visit and you find things everywhere. There's almost no place for you to walk around, particularly the kitchen and in the sitting room. It's filled with furniture, and in the kitchen is filled with cooking utensils. Now, if you really care for your kitchen, you will not want it to be clogged up because there could be an accident there. The same thing in your sitting room. If you fill it up with property, you will not be able to clean it up properly. You will not be able to care for even the property that is there. You will not be able to go underneath. Nothing that you use will be able to go underneath. Even if it is a hoover, will not be able to go underneath. If it is a broom, you will not be able to go underneath to get to the deep recesses of your sitting room or parts thereof. So whatever you have requires care, not necessarily of the body, but today we are going to concentrate on the body, the human being, the entirety of the human being. When I'm talking about the body now, I'm not talking about the physical body, but the physical body, we are going to discuss it. Next slide. So this slide shows the stages of life for a woman that is post-birth. Like I mentioned earlier, life does not start at birth. When that newborn baby girl or baby boy is born, what do you notice? What is the first sign of life? All of us know that the first sign of life is the baby crying. But it may interest you that that baby never cried while in the womb. So the baby is welcomed into this world, a different environment, and the baby cries. That baby is seeking for attention, wants to stay alive in this new environment, wants to be cared for. And it is because that baby girl wants to be cared for. In this case, the baby girl, what applies to the baby girl applies to the baby boy. That baby girl, God has built an instinct into the baby. The instinct, like I said, is to stay alive, and therefore the baby girl does something to stay alive. And this is what we are supposed to do throughout our lives. For the baby girl, the instinct is to look for food. And therefore, it has been built in. It is a reflex that that baby will want to suck breast. It can be very frustrating for the baby. And usually it is very frustrating for the first-time mother, because the baby girl is trying to breastfeed, but nothing is coming out. For some babies, the effort will not take long before the breast milk comes out. But we also know that there are some babies that have to wait for 1 or 2 days before the proper breast milk comes out. So the baby is born into a hostile environment, different from what happened inside. And it is important to note that many baby girls do not survive the first 24 hours. Others don't survive the first 6 weeks. Others don't survive the first 1 year. But all those who are listening to this presentation went through all that successfully. And the fact that they went through that successfully means that they moved to the next stage. It's like moving from the crèche to nursery school to primary school and so on. The next one is the girl child. It may interest you, especially those of you who have girl children, to find that the girl child goes through a lot. There's so many things to learn. So this girl is supposed to learn those things. The girl child would have learned to know who is family and who is not family, to know those who wish it well, and then to know those who to play with. Some children, some girl children follow just anybody, while others follow specific people. As time goes on, the female teenager is no longer a newborn baby, neither is she a girl child. But one of the things that those who have teenage female children, teenage females, realize is that the female teenager feels that they are adults. But we all know that they are not. the fact that the teenager is taller than the mother or taller than the father does not mean that the female teenager knows as much. So there's a tendency to make mistakes. And if you are going to care for this woman at this stage of development, we also need to understand the female teenager. This is where many parents get it wrong. There's a tendency for a parent, especially the mothers, to feel that the female teenager that they have will behave exactly the way they were behaving 20, 30, or 35 years ago, or 40 years ago. No, the environment changes and it affects the female teenager. So from the way I'm presenting it, I hope you are following very carefully. It will show you that the challenges of the female teenager affect the mother and affect the father. And the father and the mother and other people, other significant people in the life of the female teenager must ensure that they understand what the present day at any point in time, what that female teenager is going through. If the person who is supposed to be caring for this female teenager shows a total ignorance of what the teenager is going through, in this case, we're discussing female, but the same thing applies to the male. Then, if you get it very, very wrong, the female teenager may now dissociate herself from the mother and from the father. And when that happens, what do you think will be the result? One of the results will be that the female teenager will look for care and comfort from some other source. That other source may be an adult in the same age bracket as the parents. And if, unfortunately, that adult seems to understand the teenager, but then makes the teenager's attention deviate to the right, deviate from what is right, then that female teenager, in as much as the parents are working very hard and sending the child to a very expensive school, exclusive schools, high-profile schools, that teenager will be following another person and not the parents. At other times, it may be that a female teenager who is a peer may want to show attention, to give attention to this female teenager. And then, because of peer pressure, the female teenager follows another group. And it may be for something positive, but the dangerous one is if it is for something negative. So the female teenager who thinks that they understand, they know what life is all about, may now veer off the way by following not adults, but people of their own age group. I don't want to discuss what could happen if the person that shows attention is a male. Now, the young adults. Young adults, for example, the young adults in Nigeria are facing serious challenges. I remember when I left school as a young doctor at the age of 24, it was very easy to get a job as a doctor. In short, one had to choose. You had to choose where to go and do your housemanship. But today, Our children don't have such luxury. Some people wait, some young doctors wait for months before they have an opening to do their housemanship or what is called internship. And those are for the doctors, but there are other graduates. The young adults who have gone through the university, and most parents want their children to become graduates for whatever reason. This does not apply in many advanced countries. So we now have a large number of young adults who are job seekers. They cannot find jobs, not because they're not qualified, but because the jobs are fewer than the graduates. So middle-aged adults have their own challenges also. I think we should be able to discuss that as a group, depending on the questions that are thrown up. Next slide. Next slide, please. So we now talk about building. What does building entail? It entails being intentional. To choose and hold a useful idea, which is important to indicate that some people are also intentional and they intentionally choose and hold useless ideas. It just depends on the group they want to belong to. The next one is a plan. It's important to have a step-by-step approach towards a goal. A goal cannot be achieved without a plan. Then focus means that the person will refuse to let go of the idea or plan. There's concentration. You concentrate on something, you refuse to change your path because you know that the path that you are taking, the idea and the plan are good. You modify only when there is a better plan or you find that what you were holding was wrong, the wrong alternative. The finishing is important. There's no need to follow a plan and stop along the way and not follow it to the end. This has been a problem for many people. You try to build something pertaining to your life, the woman starts to build something and then changes plan. So we are going to see how we are going to integrate this into the things that we're going to discuss later on. Let's go on. Next slide. Yeah, can we have the poll?
Yeah. So can you confirm you can see the polls now? Yes, I see responses. Okay, in another 10 seconds, I'll end the poll. Okay. Okay, so for the polls now, which of the following do you consider as representing the word disease? Yes. So 37% say malaria and typhoid, then zero headache, zero tummy pain, then 63% say a harmful change in body function. I hope you got that, sir.
Yes, that's the correct answer. The last one, a harmful change in body function or body structure or both. A harmful change to the way your body functions or a harmful change in the structure of your body. Our body is basically built to take care of structure and function. So the WHO, the World Health Organization, definition of health is that it is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. A total physical, mental, and social well-being, and not merely the absence of disease or infirmity. Before we leave this slide, I want each of us to look carefully at every component of that short sentence or that short definition. And is there any one of us here who is really healthy? Is there anybody who is here who considers themselves to have a complete physical well-being, a complete mental well-being, and a complete social well-being? Because many of us may be concentrating on the fact that, oh, we don't have disease or we don't have infirmity. But let us see what is disease and what is infirmity. It is difficult for anybody to say, oh, I am in complete physical, mental, and social well-being, as we are going to see. But then we want to see what can be done about the well-being of the woman. Because the woman really needs to be well. So let's look at it. The well-being of a woman should be attended to by everybody. But then if nobody wants to take care of a woman's well-being, the woman herself should take care of her well-being. What is our general concept of disease? Some people say malaria and typhoid. Nobody, but they're right and they are wrong, but that's not the best answer. But then because the expression malaria and typhoid is so common, people feel that that is disease. Malaria and typhoid is not the answer to disease, or disease is not malaria and typhoid. Much deeper. It can take different forms. So what is disease? So for me, a very simple way of breaking it down is to divide that word into two. The first one is dis, D-I-S. The next one is E-A-S-E. DIS refers to absence or lack. So that means you can easily see medicine as, easily see a disease as absence or lack of or disturbance of ease. If your ease is disturbed, or you lack it, or you have lost it, then you can see that as disease. That is my own definition. Why is it important to know what disease is? The reason why it is one of the reasons why it is very important to know what disease is that there are many people who are diseased, but who think that it is another person who is diseased. And when somebody feels that they don't have a problem, but it's another person that has a problem, what do you think would result? What do you think could result? One is that the person's disease is allowed to continue to progress or to get worse until eventually they now realize that, oh, means all this time something was wrong. When we get to the human body, the slide on the human body, I'm going to explain it further. Now, the other person that you think is disease, that is, the person may have an overt, something that is very clear that something is wrong. You feel that that person is the one who has a disease. That person may actually attend to that problem and get well. But the person who does not even realize that there is a problem may now end up having a very serious problem. I will give an example. There are many people who are those, I don't know the age bracket of the attendees. But if you are 40 and above, you may not realize that you have high blood pressure. And therefore, if you do not know that you have high blood pressure, you may not attend to it. And if you don't attend to it, you may end up having complications of high blood pressure. Many years ago, which year was that? I think it was around 2008 or 2009. I had an employee, 24 years old. She came to look for employment, and in my place, everybody that looks for work has to go through pre-employment medical examination. When I examined this young lady, 24 years old, a nurse, I asked her, what is this scar on your breast? I'm not happy to mention this, but it is a wake-up call, since we're talking about women. She told me that there was something there, and then I said, what was there? Tell me what happened. Well, I could see the scar. She said that there was something in my breast that I went to the hospital and they removed it. I said, when you went to remove it, what did the doctor take? Did they take the sample to the laboratory? She said, yes. I said, do you have the result? I want to see the results. You can send it to me later on. She said, no. I said, why don't you have the result? I said, I tore it. They gave it to her as a piece of paper. She tore it. I said, why do you tear the result? She said that she rejected the results of the doctor. I said, you, a nurse? 3 months later, this young lady who came to look for work to attend to other people died from complications of breast cancer. So it is important to know what this is. The fact that somebody is walking around looking for a job or helping other people does not mean that the person does not have disease. You may be seeing another person as having disease and not you as having disease. What does disease do to a woman? Going by that simple definition, explanation, let me not call it a definition, that simple explanation that I gave, I will say that what disease does to a woman is to rob the woman of her ease, to steal her ease from her. So if you know that somebody or something is trying to rob your ease, your comfort, your well-being, would you let it continue to happen or would you not want to attend to it? Definitely you want to attend to it. What a woman's attitude to disease should be. For me, I try to let my patients know that their attitude towards disease should be to accept what is happening to you. What the doctor says, oh, this is what is happening to you. But many people, in my experience, say, God forbid. Sometimes as soon as you open your mouth as a doctor to tell somebody the diagnosis, you did not go to the person's house. So the person came to your clinic or to your hospital, and then want to do a check. And then you now say, this is the result of my finding. The person just says, God forbid. And other times, they don't even want to understand. They don't want an explanation. They say they're wasting time. They don't want to listen. They just wanted to get this result and go away. So the woman's attitude to disease is that she realizes that this thing is something that is already taking away your ease or will eventually take away your ease. Next slide. Next slide, please. What is infirmity? Infirmity is just weakness or frailty when there is a reduction in function, or a prolonged state of unwellness, protracted state of discomfort. And it is frequently associated with advancing or advanced age. But there are young people who suffer from infirmity. They're not able to function to their highest potential. Every now and then they are in the hospital. They cannot do certain work. They cannot do certain work because of the state of their health. So this is infirmity. Let us move on. Next slide. Next slide, please. Physical. Now, you are going to the definition, the first three things that we discussed, we mentioned in the WHO definition of health. Physical is complete physical well-being. I want to give examples from head to toe. So let us pay attention to this. Very briefly, starting from the head, I want you to imagine a woman whose hair is unkempt. The men may not understand that a woman's hair is very, very important. There are some women who may not want to go out of the house. They may not want to go to work. They may not want to go to church. They may not go to attend certain social events if they do not consider that their hair is in good shape. But let us now talk about something actually going wrong with the hair or the scalp. If a woman has dandruff or has any disease that affects the scalp, that woman may not be able to concentrate because of the itching that takes place in the scalp. And therefore, it is not good to discountenance a complaint of something pertaining to the hair. The next one will be the ears. There are many women who don't know that they are supposed to be going to the hospital to check their ears and their hearing. This can be done and done very easily when you go to the hospital. The funny thing about hearing and hearing loss is that the person who has hearing loss may not realize that they are losing their hearing acuity, the capacity of hearing. They will not realize that they are losing it bit by bit. And this may happen right from when the person is a child. Something like measles, severe measles, or severe meningitis can make a girl child grow up and not be able to hear well. And therefore, you are talking to the child does not hear well, the mother does not understand, the father does not understand, and therefore, he may beat the child. I talked to you and you did not answer me. That child may not have heard what you said. But you don't know that the child is not hearing well. The child is completely at a loss, does not know why they are being beaten, because they did not hear you well. It is as time goes on that you now realize the hearing was not okay. It is only when you go to the hospital to see a specialist that they will do a test and say, oh, this child is not hearing well. The same thing with the vision. Sometimes people who lose vision may know that they're not seeing well. But there's a kind of vision problem that people have, and they will not know until it is almost late. A very good example is glaucoma. Glaucoma is when the pressure in the eyes continues to rise until it puts so much pressure on the back of the eye, and the nerve that arises from the back of the eye and goes to the brain is not able to function again. It kills the nerve cells, the nerve fibers. And the result is irreversible. That is glaucoma. Do not think that it is when you are 60 that glaucoma will start. It occurs in people who are 20, people who are 30, people who are 40. So it is important to go for your eye check. When you find that you're changing glasses frequently, you don't need to wait. But when you find that that is happening, and it is not because the eyeglasses are scratched, the lenses are scratched, but because you just cannot see with the same glasses that you used 1 year ago or 6 months ago, it is good to go for a proper eye check. Don't just go and get glasses and go away and wear glasses. You continue changing until you are not able to see again. And then nose. This other one may sound funny to people who are not in the medical field. The very first nerve that got put, there are 12 cranial nerves. There's a nerve that comes from the brain, arise from the brain. There are 12 of them. The very first one is called the olfactory nerve. And what does it do? It is to take care of our sensation of smell. So the number one nerve is the olfactory nerve. It takes care of our smell. We may not realize that the ability to smell is one of the biggest senses, abilities that God has put in us as human beings. I want you to imagine a situation that you are in your house and you have lost. Some people lose it. We call it anosmia. When somebody cannot smell something, the person cannot smell perfume, cannot smell smoke, cannot smell petrol, cannot smell anything. Even if the petrol generator is producing carbon monoxide, the person will not perceive that smell, and therefore the person has lost protection. Our ability to smell is part of the protection and for care of our bodies that we have. And by the way, if everybody could not smell at all, what would happen to the perfume industry? If every other person could not smell, and you're the only person that smells, would they be wearing perfume? Would not be using perfume? You will not. So our ability to smell is very important. We know that during the COVID-19 period, the lack of smell, the loss of the ability to smell was one of the features of having the COVID-19 infection. So we now move to the other part of the body, taste. Our tongue, to be able to taste and to be able to speak. Taste is very important. So we should protect ourselves. You may consider it difficult to protect and to care for our taste, but it is good for us to watch that you're able to test the things that you were still able to test before. If you cannot test those things again, please seek for help. Because part of caring for yourself is knowing the taste of what you are cooking, what you have cooked. If as a woman, you cannot taste what you're cooking, people may not like your food. You may think you're cooking very well, and they may not be able to tell you that, look, I don't like the taste of this food, out of respect. Who wants to hear that you did not put enough salt or you did not put enough pepper in food? So we now want to move on to, and there are other things that we want to talk about, the skin, and then other things in the body. But when people ask questions, I'm going to answer. Our time is almost gone. Please go to the next slide. Now, complete mental well-being. This one is tricky. Most people believe that they are very well in their minds. Their heads are correct. They are fine mentally. But it will surprise you that if there are 100 people in this webinar, at least 10 of them or 10 of us here have an issue with our minds. And you will not know, because that other one is very simple. It is when the people that have mental problems, people that we consider as having mental problem, are the ones that the mental issue is very obvious. But for most people, the mental challenge that they have is subtle. It is not easy to identify. They themselves will not identify. Even people who are with them will not identify. They may notice some awkwardness, some changes taking place in the baby. It may just see it as normal. It is like borderline, neither here nor there. It is only a specialist who will understand. And then what we find is that it is very difficult for people to go to a hospital and say, please, check my mind, check my mental health. People hardly go to a hospital and say, check my mental health. What they do is that when somebody's mental health has become totally deranged, that is when they will take that relative or that friend or that neighbor to the hospital. Now, what does our mind do for us? Our mind helps us to stay conscious. Our mind helps us to remember things. Our mind helps us to learn things. It also helps us to teach other people. Because if your mind is not okay, you'll not be able to teach even what you already know. It also helps us with sleep. And then, I used to tell some of my patients that, look, if you do not have pregnancy yet, or you do not have a baby yet, don't trouble yourself so much about it, because in my own words, so it is not in any textbook, pregnancy starts from the brain, from the head. Pregnancy starts from the head, because the major hormones that are produced and that control the ovaries and control the womb are in the brain. So while the woman will be looking at herself at her beauty, and then the man will be looking at her beauty and other things, as you know, that pregnancy starts from the brain. So I would encourage all of us here, try and encourage yourself to relax. Encourage your parents, for those who are who got married recently and their parents are beginning to say, oh, let me have the baby next 1 year, next 9 months. Ask them to relax and also allow you to have your peace, because the pregnancy will come, every other thing being equal. So the mind is very important. It is our mind that helps us decide what to do, and it helps us to persist. It is our mind that makes us surrender. It is our mind that makes it is our mind that it is a lot of the things, our failures are at the level of our minds. We listen to our minds and then we surrender. So I would like to encourage us to do a lot of work on our minds. Can we go to the next slide? Next slide. So this is part of the brain that takes care of learning, takes care of memory, takes care of all kinds of things. So let us move to the next slide. Next slide, please. So this limbic system is situated deep, deep, deep inside the brain. We are not going to trouble ourselves with them, but when you receive the material, you can take a look at them. Creation of memory, and the thalamus, for example, is a relay point. Like when you're doing a relay race, you do your own bit and then hand over to the next one. So the thalamus is there as a center that receives things. It takes over and hands over to the next one, and receives from this other one and hands over to the next one. So let's go on. Next slide. Your emotions, your behavior, your motivation or lack of motivation all take place in the brain. Complete social well-being. It is said that man is a social animal. Please, let's not take that as an insult. It refers to the woman also. Women are social animals. We don't want to stay alone. There's nobody who wants to stay alone. We want to integrate with other people. And these people may be right from childhood. The family is the beginning of the society. So when a girl child does not have a family, or the father has run away and left the mother to take care of the baby alone, the girl child alone, it's difficult. Because it is better for the two parents to take care of a girl child. The same thing applies to the boy child, but it is the damage will be most severe in a girl child. One of the good examples is if a girl child is alone and then some foolish young man or boy decides to impregnate that girl child when he becomes a teenager. The boy will certainly will run away, and this child that was looking for attention is now so badly damaged or traumatized, okay, that so many things can go wrong. We know these things. So I'm just bringing our minds, but I'm not giving a lecture on this. So you see these people that are gathered here, they're smiling. That means that they are in a good, in an acceptable, in a desirable social setting. They flow with one another. But then there are certain groups that you may find yourself in, and this group may be in the church, may be in the mosque, may be in a camp, may be in the place of work, that the woman does not feel comfortable. And if there is no social integration, you now find that the woman will feel, or the girl, depending on the age, will feel isolated, and nobody likes that isolation. So it is important to build these social contacts. And the way to do it is to look for people who think like you, people who have the same mindset as you. The reason why it is good to find people who have the same mindset with you is that when you have them, it is like iron sharpening another iron. They help you to move forward. But if you now find yourself in a group that does not flow with you, then they will not assist you. And this is throughout, from childhood until old age. It is a bigger problem when people get into the latter stages of life, maybe in old age. It does not happen in our society, in the Nigerian society. It's not common in the Nigerian society where people abandon the old ones, the elderly ones, and therefore the elderly ones, even when they were the breadwinners, the breadwinner can be a woman who was a strong woman. By the time the person becomes 70, 75, 80, they now say, oh, you are supposed to be in a home, okay? In another home that you did not want to be, older people's homes, and many do not like it. It is still a society, it is still a social setting, but we all know that as we grow older, it becomes more difficult to build relationships. So how do you now go and be building relationships with people that may not be of like minds later in age? I'm mentioning this example to help us know that we should help our parents, the older ones in our midst. They don't need to be parents. They may be other people, maybe neighbors. Assist them. Just going to visit helps. And many people, many women die out of isolation, feeling neglected. If, as a younger person, you do not like to be neglected, you do not like to be alone, how do you think it will feel when you are much older and you need assistance? You need assistance in doing things. And we should know that at that age, money does not always answer everything. At that point in a person's life, they need to see a human being. So if you are a child, a big child, so to say, because we are still children to our parents, no matter how old we are. And the mother says, please, I want to see you. And you say, oh, a video call is there, I can do video call for you. Video call is a virtual thing. Whatever you're doing there is virtual. That mother may still want to see you physically. And when you think about the cost of flying from Abuja to Lagos or Lagos to Calabar or Calabar to Akure and so on and so forth, please remember that this person who desperately needs your attention was the one who sacrificed to take care of you when you were small. This is now women interacting with women, but the same thing applies to the men. It seems to be worse with the men. That is, the men think that their mothers usually feel that their mothers should still be able to function, continue to provide the way they were providing. No, a time comes that they now want to be attended to. Next slide. Next slide, please. Next slide.
Yeah, I think we're having another poll now.
Okay, sorry.
Yeah. Okay, so we can send in our responses. Okay, we have about 30 more seconds. So sorry, I was stuck and muted. So we have the result now. Which of the following is the most important to you? So about 20% says body health, which is physical. 60% says mental health, their mind. Another 20% says their spiritual health, which is their spirit. And zero gave opinion on their social health.
I'm sorry that I'm laughing. I wonder, is it that people did not expect the question and did not refuse to answer that part about social health? Or is it because we've not heard that expression before, social health or social well-being? Yes, the truth is this, that that question I asked does not have a specific answer. There is no best answer. It simply means that this gathering considers, what was it now? Considers mental health. Am I right?
Yes,
Mental health is
mental health
60%.
have the highest response here.
Correct. Okay. So the question, I will now want to look at that. Why is it that the women consider mental health as being very important? Before I answer the question, if the men were here, do you think that they would have considered mental health most important to them? Please just let us just use the chat box. If this was a group of males, men, young people and so on, do you think that they would have considered mental health as the most important to them? Because from what I see here, 60% is a clear majority. Maybe now, can you just tell us what the answer is?
They may have wanted another option. Maybe that has to do with financial health.
Okay, that's a good one. There's another one I wanted to mention, which I'm still going to mention. What is the response that you're getting there? It's good that we are not plenty.
Yeah. So we have someone who said men will prefer social health.
Correct. Men would have preferred social health, but then the men would not realize that the social health, their emphasis on issues on the social aspect of their well-being has a way of affecting their mental health. Let me explain that. The women, because of the challenges that they handle, sometimes I actually do not understand how women are able to cope with this kind of multitasking that they do. The woman is taking care of the home, going to work, being involved in social activities, and doing all kinds of things, solving so many problems. The things that the men are doing, the women are doing the same things, and they're doing more. Even in the home, in many homes, the men feel that certain things are for women, and they're not supposed to be involved in those things at all. It could be cultural. So this is a very, very wide topic. So what I will say here is that even though there may not be men in this group, it is good for the men to begin to know that women see their mental health as very, very important. And therefore, it is not good to allow a woman's mind to be traumatized. A woman can be traumatized mentally just by abuse, physical, I mean, not just physical abuse, even verbal abuse can traumatize a woman and disturb the woman's mental health. Or financial deprivation for those who are not working can disturb a woman's mind. Or even when the woman is earning so much and cannot enjoy the money, does not have time to enjoy the money, it is a problem. So many things Anyway, this meeting is supposed to end by now, so let me quickly fast track the remaining slides. Please, Obina, let us make it faster so you can now attend to questions. So you can read the presentation, you can read this slide. The teenagers are not here, so maybe we can move on. I don't think the teenagers are here. Let us move on. Alternatively, we can take your mind back to when you were a teenager. But let us look at this one. When I say owning this presentation, try to see how this slide and how what you have discussed so far are applicable to you. For example, what occupied your mind before your wedding day? Was it not that social gathering? Usually it is a social gathering and how beautiful you look on your wedding, in your wedding gown, the music, the cake, and so on and so forth. Those are the things that occupy your mind before your wedding day. But then without photographs and videos, how much of the ceremonies and attendees do you remember? My wife and I, we had a very funny experience. We got married 41 years ago. We got 3 people to take photographs. There were no videos those days. To take photographs, that was 1984, of the wedding. I do not know where the photographers enjoyed the ceremony, and then all the photographs came blank. The reception, everything came blank. So I, for one, do not fully remember. My wife may remember, she has very good memory. I don't remember most of what happened at the wedding reception, but I remember what happened inside the church because we did a church wedding also. So what I'm trying to say is that women are very interested in certain things, but then because of being overwhelmed by some of the activities, we may not even remember the details. But people's capacity for remembrance is different. Now, what effects did becoming pregnant within the first 3 months of marriage have on your marriage and you? One of the things that we know is that when a woman gets married, gets pregnant, okay, the first month, the second month, the third month, many of them are very, very happy. But others are not so happy. Why? Because they did not have the opportunity of knowing the person they got married to. And just summarizing this, the women may tell us more of the experience practically. What effects did multiple miscarriages have on you and your marriage? You know, because of the kind of beliefs people have, they attribute the miscarriages to various things. Some of the things that in-laws attribute as a cause of miscarriage can be ridiculous. And when there's an accusation of one thing or the other, sometimes completely outside what you know applies to you, but then that accusation is given to you as a woman, how do you feel about the miscarriage? How do you feel about the marriage? And so on and so forth. What effects did waiting for 3 to 5 years before having, what the effects did waiting for 3 to 5 years have on you before you had your first baby? Some women feel very seriously traumatized if they have to wait for 3 to 5 years before they get their first baby. So all these things are challenges that a woman may not be prepared to face, but it is good to prepare their minds for these things. Next slide. Next slide. Next slide, please. As a mother, When you now became a mother, what passed through your mind about yourself on the day you had your first baby, your baby girl? Some of the responses will be positive, other feelings will be negative. What about when it was a baby boy? I decided to put that other one because I have found in my practice that sometimes the women, okay, a woman is more interested in getting a baby boy than a baby girl. Meanwhile, another one may be interested in having a baby girl first. Then the boy should come later. They give all kinds of reasons. They say, oh, let this other one come and let me come be putting flowers, be putting buntings and all those things on the baby's head, or the little baby's hair and so on, fine pink dress and all those things. So they have the imagination before a baby is born. But it's not a big problem these days because you know the sex of the baby before the baby is born. In our own time, it used to be a problem. Somebody says, I want a girl first. What passed through your mind about her and her future welfare, vis-a-vis your experiences on the day you had a baby girl? So the day you had that baby girl, were you really thinking about the baby's future? Or you were just thinking about the fact that you had a baby girl? Did you really know the amount of work you're going to do to bring up this girl, this baby girl? There are some families, there's some families where you find that the first two children, when they are born, the husband and the wife are together, they're in the same, working in the same place, but then maybe after the first baby, after the second baby, the wife is transferred to another place, or the husband is transferred to another place, or gets a job in some other place. Okay, so the family begins to suffer. It is not easy for the woman because usually the very small children, whether boy or girl, will be with the mother. Meanwhile, like I said earlier on, whatever the man is going through, the woman is also going through, plus these added responsibilities. What plans, if any, did you make regarding helpers? This one is another presentation entirely, talking about house helps, what we call house helpers. If we must call a spade, for many people, helpers are actually destroyers. Next slide. Next slide. Yes, the woman as an employee or an employer. This other one too is another big topic. But we know very well that women go through a lot in the place of work. Many hardly sleep. Many hardly rest. Many cannot take proper vacation. Even when they are given even when they are on annual vacation, they cannot enjoy it. Before you know what is happening, maternity leave is finished. Before you know what is happening, the vacation time is finished. Those who are employed have challenges. Those who are not employed have challenges. Those who are employers have challenges. Those who are yet to be employed also have challenges. So a woman finds themselves in a very difficult situation. Next slide. Next slide. As a member of the society. Now, this is where you now find the social interactions. These are just a few that can pull you apart. Your alma mater. Contribute this, contribute that. Somebody has a baby. Somebody is getting married. Somebody is having a birthday. Somebody is, the father is dead, the mother is dead, somebody had an accident, is in the hospital. Your alma mater will be pulling you left, right, and center, almost tearing you apart. Then your church or your Christian group. I don't know what happens in mosque and Muslim groups, but I know that some churches have actually destroyed marriages knowingly or unknowingly. How does this happen? A woman goes to work, and then when it goes to pick the children, sometimes the woman who goes to work who also goes to pick up children from school. Then after picking up the children from school, you find that there's a meeting in church. So we carry the children and buy them biscuits. They go to church. And then the children eat biscuit as lunch. They wear the school uniform. They will finish service around 6 o'clock or 7 o'clock, usually around 7 o'clock. And then they go home. Then there's homework to do. And then they will now go to sleep. The following morning, they rush the children. The children want to wake up and go out. So you make sure the woman goes through this stress. And then the children, especially the girl child, goes through this stress and goes up. And when they grow up, I don't want to say what happens, we know. Then your club, you belong to a club. I don't want to mention the names of the clubs, but the women know the clubs that they belong to. Then there are also important people in their local community. Sometimes they are political party people. Sometimes they are very important, they hold very important posts, maybe professional groups, they are leaders there also. And what does the society expect from you? A lot of times, it is what the society expects of the woman that creates a problem for the woman. But some other women, when they are taking all these responsibilities, they may not be fully aware of the toll that these positions, these social interactions take on them. That photograph that I showed all the ladies there smiling. It now gets to a time that you can no longer smile. Let us go to the next slide. Next slide. Next slide. So we need resilience. And resilience has something to do with your mind. When you see this kind of difficulty, it says when the going gets tough, it is the tough that get going. Balance. No matter what we do, we must try to strike a balance. If you don't strike a balance, your life will not be okay. You live till you're 50, 60, 70, even 80, and then you are not in control, you are not able to balance things up. One thing or the other thing suffers. Sometimes you lose your marriage, other times you lose your children, other times you lose your job, other times your friends leave you because you are no longer relevant to them. It is important for women to understand that friends come and go. Your friend in primary school need not be your friend when you are 60. I would like to end this presentation at this point. Long and short, balance and resilience. No matter what you build, you must ensure that there is balance and there is resilience. If you give up, you may lose everything that you're trying to build. If there is no balance, then there will be a very big problem. Thank you very much.
Well, thank you very much, Dr. Olcott, for this very insightful presentation today. If nothing was so loud to me, is the fact that I think personally I'm learning that women's mental health means a lot to them. And if there's anything we can do to preserve that and help them have a better um, mental health, a more stable mental health, then we are enhancing um, their lifelong care, right? Enhancing the quality of life that they are going to put out there. Thank you, Doctor. Dr. Olcott, for this. And
Thank you.
so we want to quickly see how we can engage Dr. Olcott again. So from experience, I found out that no matter how much you think a speaker has spoken during the session, there's much more that will come out from him when we have the right questions. So I want to ask, do we have questions? Are there any questions? I'm looking now at uh, the question, the Q&A section, um, and even the chat box. So you can please drop your questions and your inquiries, and let's see how we can engage Dr. Okot more, even if it's around the mental health area that seems to be of interest to us. Are there things we want to find out first? A lot of people are agreeing that yes, somebody said I wanted a girl first, like you mentioned, Dr. Okot, and they all have their they all have their reason. Um, so are there any questions, please? We can drop them now.
It doesn't have to
Can
be
I
only
ask?
questions. They can share experiences briefly.
Okay. 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 While they're preparing for that, so I have one here. Um, hmm. So this person is asking, how can we manage our health in a very fast-paced work as women? I think that's a very wide question, but yes, doctor, that's the question.
Okay. Now, the first thing we must remember is that the fast pace of work will be getting faster in the next 3, 5, or 10 years.
Wow.
So, unfortunately, the way our lives are now, the way the work environment is now, is that there is no patience in the workplace. The employer wants to get the very best out of you. They also want to get the most out of you. And getting the most out of you may mean extracting the last drop of blood from you if you allow it. So, what do you do in this very fast-paced? It's for you to know yourself. One of the things that happen is that women, when you see somebody of your age, you may think that everything about you is equal, but no two people are actually the same. That is why somehow, I don't know how God did it, He gave us very different fingerprints. There are certain things that may be similar, but no two people are the same. Similarity and sameness are different. So the fact that you have an employee that is able to take up certain responsibilities at a certain pace does not mean that this high flyer should be the standard, because other people may not be able to cope. And then when you want to match the high flyer, or want to match every other person with a high flyer, they may be missing it as an employer. Because people would look for ways to cut corners and give you results that are not real to be able to stay in the job. So it is good for the workplace to be made such that the employer understands their employees and the employees understand themselves. If you do not understand yourself, it is a problem. When I say understand yourself, know your capacity. So increase your capacity and make the best of your potential. Attending things like this will help give you more knowledge. Don't sit down in one place and then do not think that you must always be on top. There are some people who were performing very, very well within their first 40 years of life, and between 40 and 50, they could not perform very well. Others were not performing very, very well up to the age of 50. They start performing very well between those remaining years before retirement. So what I'm trying to say is this: in this fast-paced life that we are living, it is good for us to know that you do not need to drive like the drivers on Airport Road every time, Abuja Airport Road. Because sometimes there could be an accident. The accident may mean you're losing your life. The accident may be you're losing your ability to function. The accident may mean that you lose your husband. The accident could be that if you pursue it, you may not even get married. You may look at it, when you look at it very practical, you don't find that, look, there's no way I'll be able to combine this kind of work I'm doing with marriage. And therefore, you cut off marriage. But then at the end of it all, how do you strike the balance? Striking the balance is an individual matter. And then I've seen all kinds of things. I've seen a situation where somebody felt that a serious high flyer. I don't want to mention the names. Okay, I know somebody who was a proper high flyer. The person did not even live up to age 55. The person died. And I was shocked when I realized that the person was replaced within 1 week. The person was replaced within 1 week. It doesn't mean that you shouldn't put in your best. Put in your best. But then, please, think about your health. Think about every aspect of your health, the physical part of your health, financial. Because what most people do is to look at their financial health. I didn't mention financial part there. Okay. If I was making a presentation to men, I would have talked about the financial. But sometimes we find women who have been sucked into this matter of finances. They have all kinds, everything money can provide. But they lack the things that money cannot provide. But what we said was balance. Let us try as much as possible to get balance. If it means retiring early, you do so. If it means you work in a very fast-paced environment or place of work, and then you get all the money you can get, then please invest the money. Invest the money, let the money eventually work for you later. But I know of some people who have worked in places where they get very high pay, and then they also spent almost more than what they were earning. At the end of the day, they were none the better than those who did not earn so much. And then the other matter is the high flyers, or maybe those who are in a very high-paced, fast-paced work. They end up comparing themselves with the others. If this person, for example, a woman should realize that if they were in the same salary bracket as another woman, that you may not be able to achieve as much as the other woman, or you may achieve more than the other woman. Don't despise the other person who is not able to achieve as much, because you do not know the other responsibilities that the person is carrying. The fact that you have built your house at the age of 35 does not mean that you should look down on the person who has not built a house yet at the age of 40 or even 43. It depends on the amount of responsibilities. And you never also know what will happen if you have an illness. Okay? So, long and short of the whole thing is that in this fast-paced work environment, let us, the way we say it, shine our eyes. If you don't shine your eyes, something will go wrong.
Well, thank you, Dr. Lucas. I think there's a lot of wisdom also that you're sharing here from your also a lot of years of experience. I love the way you said something about those who may have achieved early, and that shouldn't get us into pressure because some people also begin to achieve later in life. So um, perhaps we can say like we're all running different races, as it were, and we don't have the same, well, like the finish line or touch line. So there's no need competing with another. And I would have asked another question someone dropped here concerning balance, but you sort of merged it while we were talking about the fast-paced life. So maybe you can just take one more very briefly. Somebody wanted to ask, okay, so uh, what about the aspect of helps? House helps? It's like you mentioned it a bit in passing while you were talking. If you could just say a word in a few minutes as we plan to round up, sir. Yes, sir.
Okay, let me mention just two things. Number one, please do not employ any house help before without doing a pre-employment medical examination. Don't. You may end up being penny wise and pound foolish. Do not employ anybody to help you in your house without doing a pre-employment medical examination. Number two is that do not employ any helper without doing a proper orientation. Don't allow anybody to tell you, I've done this kind of work for 3 years or 5 years, and then you employ the person. Your home is different from the home of the person, where the homes where this person worked before. Do an orientation before you hand over your children, your home to somebody. Please. The person may not have stolen anything from the former place because they did not find something attractive to steal. But in your own place, the person may find something and decide to steal. Thank you. I was
All
told to
right.
be short.
Yes. Thank you. Thank you so much, Dr. Okut. I think you've done justice. There's so much. I wish we had done the presentation shorter and then allowed people to ask questions because usually a lot of juice comes out from the question and answer session. But um, they are from my checks now, both on the chat box and from the question and answer, we seem to have touched on all the areas. So quite a lot of people are just giving positive reviews. Thank you for for this educative presentation. I really learned a lot. This is from Farida Mukhtar. Somebody said, "Thank you so much, sir, for the presentation." Okay, asked about balance. You've already said it. Um, wow. Okay, so I think that somebody may find this interesting. So maybe you could just talk a bit on it. And then it's about sexual urges. So please, why does women libido, drop after childbirth? I would have skipped it, but I thought I should bring it up.
Okay, I will give a very simple answer. Everything starts from the brain. Even that libido starts from the brain. Okay, let me give an example. If you see somebody in an accident scene, do you think that person will be having libido? There's somebody at an accident scene. That is very severe accident. So this woman has had a baby. A baby, person did not know what having a baby would do. So you now see it. Look at what I didn't know that this is what having a baby entails. And then some men do not understand, will not let the woman rest. The libido is gone at that time. Allow her to take care of the changes. Hormones and all kinds of things are happening in the person's body. And then some men, I'm sorry to say it, I'm a man, but I don't belong to that group anyway. There's some men actually, when this thing happens, they get upset. They go outside. It's an insult to the woman. The woman has gone through so much, 9 months of carrying pregnancy. Some of them have had miscarriage before. And now you now have this baby. The hormones are running wild in their body. And then the man decides to go away, does not want to be this. And then one of the things I did, we agreed on certain things before we got married. Is that when we have baby, the baby will go to sleep with us. That's it. The baby will sleep with the husband and wife. The man is not going anywhere. Did not go anywhere. I was there. Okay. I was there on the same bed with the baby. When the baby wakes up, okay, Then I know when the baby is crying, I'm there. When the baby is breastfeeding, so that way you get to know what is happening. Not for you, the man, to go to another room and go and be snoring. Okay, you're sleeping, having a good sleep and snoring away and enjoying themselves. Meanwhile, the woman is going through all these things. And the fact that the woman has started work after maternity leave does not mean that all is well. Because the baby may need to go to hospital. The baby may need to, when you're in the office, you're wondering what is happening to my baby and all those things. So it is not easy for the woman. It is good. My recommendation is let the man be there. If the man is there, understands what the woman is going, what the wife is going through, after the wife has given birth to a baby, they will behave well.
Okay. Oh, thank you
Obinna,
so much. Yes, sir.
I hope you're hearing.
Yes, I heard that, sir. Doctor, this is why you called my name particularly. Well, yeah.
No,
Thank you
I
so
call you
much.
because you are the only man. You are the only other man I'm seeing here.
Yeah. Thank you so much, Doctor. You have done justice to all the questions asked. Some people are even cracking up on the chat box, and everyone is saying that it was an eye opener. You touched a lot of areas that are of concern, and you brought a lot of light. We really want to appreciate you for your time, for the wealth of experience that you've brought onto the table today. And thankfully, this session was recorded, so as many of us who are present who would want to listen again, who will also want to have access to the slides, we'll be able to share it with you via your registration. So if you joined this webinar just because you saw the later on the link to join and you didn't originally register, there'll be no way for us to get your details to reach out to you. So kindly do that for us. And then shortly after you log out of this presentation, you'll receive an email that's requesting a feedback. We just want to know how well this webinar was impactful to you and what areas you think you want us to improve upon what we have learned today. Please, your feedback is equally as important as your attendance of these webinars. We want to draw the curtain on this event this evening. But of course, from the way Dr. Okot has handled this issue, I think that this is one area we may want to keep the conversation open again and perhaps have something else, have something to talk again about women before 2025 runs out. But thank you very, very much, Dr. Okot. Really appreciate your time and your delivery today. We hope we can still call on you another time, even though we gave you some stress in making up this webinar. But thank you so much for adapting to us.
Okay, thank you very much.
All right. So on behalf of
All right.
EHE Clinics, EHE Clinics Academy, we want to say good evening to everybody. Yes, Priscilla is saying let's do this again. Yes, we will do it again. Yeah, we will do it again. All right. Bye everyone. Bye, sir.
Okay, bye. Thank you for inviting me. Okay.
You're welcome.
Thank you very much, sir.
How are you?
Very afternoon.
Okay.
My name is Dr. Emmanuel.
Oh, Emmanuel.
Yes, sir.
That's nice.
I'm the manager of the clinic. I hope you had a wonderful session.
Oh, beautiful.
Yes, that's nice.
Well done.
Have a nice relationship. Yeah. Thank you so much, sir. Let me just let them know that you are done. Okay. Yeah. Thank you. Yes. Thank you for coming.
Thank you, sir. Thank you. Thank you. Thank you.
Accept your this side.